Hey everyone, and welcome to Open. And well, happy Black History Month. I'm Rhina Valentin, your host of Café con Leche for the next hour, inviting you to get social with us. Tweet us and follow us on Instagram at BronxNet TV, or like us on Facebook at Open BronxNet Television. And of course, while you're there, you can follow moi on Twitter, FB, Instagram, Insta Stories, and LinkedIn at Rhina Valentin. So although we're still dealing with the COVID-19 pandemic, the heart disease remains the #1 cause of death among women, killing 1 in 3 women every year. And today, for National Wear Red Day, we're going to bring awareness to heart health, discussing the impact it has on women of color, along with some preventative tips as we kick off American Heart Month. Joining me today, we welcome Dr. Rachel Maria Brown and Bronx resident and American Heart Association volunteer, Natasha. Welcome, ladies.
Hi.
Hi.
Hello, good morning.
Good morning, ladies. Good morning, doctor. So let's talk about your involvement with the American Heart Association first. Dr. Brown.
Good morning. So I'll just do a brief introduction. I'm Dr. Rachel Maria Brown Talaska. I'm an assistant professor of cardiology at the Zucker School of Medicine at Hospital-Northwell, and I'm the director for inpatient cardiac services at Lenox Hill Hospital-Northwell Health. I've been working with the American Heart Association on raising the alarm for heart disease in women and heart health disparities in women of color. As an Afro-Latina, our community is at a disproportionate impact from heart disease and stroke. And I think knowledge is power, and we should spread information, awareness, and education in our community.
Yes, and thank you for bringing it here to our viewers. And we're going to learn more once we get to meet Natasha, who happens to be a volunteer, right?
Yes, ma'am. Hello.
Hello and welcome.
Thank you.
So we just want to get to know you a little bit, and how long you've been a volunteer, and I guess what brought you to this place of just being health conscious with regards to preventing heart disease.
Oh, yes, definitely. So my name is Natasha Richards, and I've been volunteering with American Heart Associate for about the last 2 years now. And so I started out volunteering with them basically to share my story and letting people know, just put a face to weight loss, and letting people know that they can have a healthy heart, and basically, introducing cardio as a source of just basically making your lifestyle and your heart healthier.
Yes, it is important. It is a mindset, and we're blessed to have Dr. Brown with us here so that she can, I guess, shed some light on some of the statistics that are out there, especially pertaining to our community, as in what we addressed in being very effective here within the people of color community.
So I just want everyone to know that cardiovascular disease kills a substantial proportion of African-American women every year. So that's nearly 50,000 a year. That's more than cancer, accidents, assault, Alzheimer's disease combined affecting Black women, cardiovascular disease. And if we zoom out by ethnicity and then break it down by gender, it's even more shocking. You know, in the African-American or Black American community, 30% more likely to die of heart disease, 40% more likely to have high blood pressure, which we call hypertension, twice as likely to have a stroke or have diagnosis of diabetes, higher rates of obesity, heart attack, or death from a heart attack. So when you break that down to Black women, the statistics are rather shocking. Over half of Black women have cardiovascular disease. Over half of Black women aged 20 or older have high blood pressure. So this is not a disease of the elderly and infirm anymore. This is affecting our adolescent, young adult age groups. 80%, over 80% of Black women have obesity, or they are diagnosed as being overweight. When we break it down into our non-white Hispanics, Puerto Ricans have the highest hypertension-related death rate of all Hispanic subgroups combined. Mexican Americans and Puerto Ricans have twice the rate of diabetes compared to their non-Hispanic white counterparts. So what about non-white Hispanic women? 1/3 of Hispanic adult women have cardiovascular disease, and over 75% of Hispanic adult women are overweight or obese. So these statistics are alarming, but we can do something about it.
So before we go to Natasha, really quickly, does that have to do with the DNA, or does it have to do with diet?
There are multiple factors, and I like to break it down into things you can control and things you cannot control. You cannot control your DNA. You cannot control your genetic predilection or predisposition to having a disease. What can you control? You can control your diet, your exercise, your weight, your tobacco, right? Whether you're smoking or not, alcohol intake. And these are contingent upon many things. Do you have access to good nutrition? Do you have access to safe ways of exercising? Do you have access to adequate health care? Do you have access to health insurance? Do you have access to a care provider? So all of these things sort of coalesce into the health of a woman and reducing risk of cardiovascular disease, and if you have it, proper treatment of that cardiovascular disease.
So I want to just speak to Natasha a bit about what she's done to alter her lifestyle, be it through eating, be it through exercise, and also when did you have this wake up call?
So I actually went to the doctor. I was having this stomach problem. I had basically I had went to the doctor just like on a whim, something totally unrelated. When I got to the doctor, I found out that day that I was 336 pounds. And so besides the whatever little reason I went to the doctor, like that totally went out the window, and when I found out, that was literally just getting on that scale and finding out that 336, that was my wake up call. Literally that day, walking home from the doctor's office, I called my husband, and he's, the doctor's office is about, I'll say about 7 blocks away from home. And I was, I was calling him. He was like, "Oh, babe, I'm sorry. Am I late?" He was going to come pick me up. And so walking home, I told him, "No, don't come pick me up. I'm 336 pounds. And so just walking home that day, it all came to me, just how my weight and my health and my eating, how it's really affected me. And so literally that day, that set off the alarm for me, and it just made me really just change my mind starting that day with the foods that I was eating and, my exercise regimen and so forth.
So how long ago was that?
That was 2 years ago.
Okay, and so where are you now? Fast forward 2 years.
So fast forward 2 years, I lost about 96 pounds.
Bravo.
Thank you. I've had some, it's been up and down. It has definitely been up
it's a little challenge. These are challenging times, so it's understanding. But however, It's all about the consciousness. And so you lost 96 pounds. So what is it that you did that created this transformation?
Literally that day, started eating, exercising, but I tell people all the time, the most important thing is to find exercise that you like. There's so many different types of exercises out here, finding the right support groups, exercise. I mean, I did Zumba, and even in these challenging times, I go back to the videos of me doing Zumba on Facebook, on lives, and seeing myself dancing with my friends, with my workout friends. And I had so much fun. It's unbelievable.
Yeah. That's wonderful. And thank you for sharing that. And thank you for mentioning that it is important for one to really find joy in their physical activity, because that makes all the difference. Doctor, before we go, are there any last words that you could share with us or our viewers, I should say, that could just put everybody on the right path, especially since we're here wearing red in honor of American Heart Month?
So we are wearing red in order to raise awareness and spread awareness in the effort to combat and eradicate heart disease among women and women of color in America. So what I want you to do is know your numbers, right? This is an American Heart Association theme. Know your numbers, know your blood pressure, know your cholesterol, know your fasting blood sugar, or if you have diabetes, your hemoglobin A1C. And if you want to know how to avoid things like that, know your family history. your genetic predisposition to these diseases, so you can do what you can to, what we say, mitigate, reduce your risk of developing these diseases in young adult life, as some studies are showing. The statistics are rising with young adult women of Black and Hispanic ethnicity developing heart attack and stroke early on. And talk to your doctor about how to prevent heart disease. We as cardiologists do not only treat disease, we are preventative or health maintenance doctors. We want to prevent the stroke, prevent the heart attack, prevent end events, right? And so you don't just see your doctor when you have a problem, you see your doctor to maintain good health. And that's what I want to convey.
Beautiful. Thank you. I like that slogan. Preventative prevents events, right? That's what you just said?
Prevention prevents events.
Prevention prevents events. I like that. Those are wise words from Dr. Rachel Maria Brown. And thank you both for being here with us. Natasha Richards, Bronx resident, American Heart Association volunteer, and inspiration. You guys, once again, for more information regarding heart disease and prevention, you can visit heart.org. And for more information on the Go Red for Women initiative, you can visit goredforwomen.org. All right, we have to take a quick break, but when we return, we'll discuss the Riverdale Wise exhibition celebrating Black History Month. Don't go anywhere.